So welcome to the AFT Construction Podcast today, and we're very fortunate to have Leila Peterson, who is owner and founder of Prescribed Health, with us today. Welcome, Leila.
Thank you for having me.
Yeah, we're excited to have you, and Leila is very active on social media. You know, we're going to have her tagged here in the show notes, so you're going to see everything she's doing from a medical side and social media, business, and one of the most exciting things you've done is, I relate it to me. Here I'm a builder. I have my market, and the medical field is very similar. You have a client base, you have a network, you start building that. If you're a hairstylist, it's the same, and now you're moving from San Antonio, from Texas to Phoenix, and you're changing that whole demographic. And I just think inside, if I'm taking AFT and moving us to another state, trying to start building that network is so much work, and you've done that. So here you are, moving from Texas. You're in Gilbert now. So how has that been? What's been the biggest challenge of opening your new location here in Gilbert?
Well, exactly what you said is finding new patients and new clients, because I'm from Utah. I've been in Texas for the last almost 8 years, and so we moved to Arizona and hardly knew anybody. So that's definitely been the hardest part, just like with any business in a new location, finding people in that area to come see you.
Yeah, so how, where do you start? Because, social media has been a good advocate for us in the sense that we get lead generation, but it's taken time, but if I'm starting from scratch in an area, how do you start building that network? Because for you, it's very similar. I have to hire superintendents and personnel and coordinators, right? You're having to hire, other medical professionals and nurses and receptionists and all these things that go into the back side of it. So how do you start building the business side as well as the client side?
Well, for clients, I have found the biggest thing has just been reaching out to people and taking every opportunity to meet people, because I didn't know people anywhere. It wasn't just the business side, it was at all. And so, at church or in the grocery line, asking the people what they want to see or what they do. And I think I met your wife that way, just reaching out to her at school pickup, know. And so taking every opportunity at every location to meet people and to reach out and kind of build a community that allows you to pull people to hire. And then that also gets patients. They might have a mother that needs to be seen for whatever reason. And then you start kind of building that community that you can start pulling from, because I didn't even have that.
Well, I love that philosophy, because when you think about business, there's a term I use all the time called silent salesman. And, social media is a silent salesman in the sense that it's people that sell your brand that aren't on your payroll, right? It's people that are, brand ambassadors that believe in what you're doing. But the other hand, you have to have that other networking. And I will commend you for that, because one thing that you're really talented at is, like my wife said, she said, I met Leila at school, school pickup, and, you were messaging on Instagram, when you were thinking about moving here, you and your husband were reaching out to me and others, and then you're very active in speaking to people. And I think that goes a long way, because most of us have our comfort zone and we're not comfortable talking to someone at the supermarket or at school, but you think of the value there, because you're doing this in a time that's even more difficult. We have COVID, right? It's not like there's a networking event. Tonight we're supposed to have a networking event with one of our vendors where there's 500 people that usually attend, and it's a great place for me to meet architects and designers. That's not happening, and so you're finding a different avenue to meet these people.
Yeah, and it has been hard for me to randomly talk to a person at the grocery store or meet the moms at soccer practice, or it does take a lot, but I've also found it beneficial in so many other ways. It's been great for my children, and you form a community of people that you can reach to for a lot of things. So
how does that work with the building side of it? Because, okay, so you're branching out, you're meeting a lot of people, you're speaking with them, getting to build a rapport in the community, because you're in the medical field. So, right, family practice, and we'll get into everything your practice does, for those listening, but from the business side of things, it's also now, okay, we find a location, we have to invest in that, we have to do the TI, we have to do the build out. So, walk us through that process of just the complexity of finding a space in COVID and doing the construction. And it's not like it's cheap right now to build.
No, and so kind of some background, we weren't planning on doing our own practice. So my ideal was to join this other practice, build a client base, and then be able to go out on my own. So this wasn't really our plan. And so when we kind of got thrown into it, it was last minute, trying to find a space. There was nothing available. looking at as many places as we possibly could to find something that would work for what we needed quickly. And we couldn't find anything. And we finally found something kind of last minute that looked like it might work, but it wasn't the exact location that we wanted. And right before we signed for that, the location we're at came up, and we went and looked at it. And I remember looking through it and thinking, man, it's a very unusual layout and it needed to be completely updated. And luckily I have a husband that's an architect, and so he had a lot more vision than I did and knew that we could make it better. So that's what we moved forward with. And it was difficult with COVID, getting, business license and all of that. It was a lot harder than it normally was, even finding subs to help complete the work. And so my husband honestly did 95% of it completely by himself. Things he'd never done before, doing the floors. He opened up a window. He had to do everything by himself. And the kids and I, since the kids weren't in school, they would go with me and we would try and help them however we could. But
that's amazing. Put in some real sweat equity, right?
Absolutely. And we were on a tight budget. They didn't give us much for TI.
Yeah.
And so it was what we could prioritize and what really needed to be done. And now if you look at it and kind of see the before and afters, it's pretty incredible what he was able to do.
So I want to come back to, I think, the pivot part. I think that's key to any business. And I want to touch on that. We'll come back to that, as well as location, that plays a big part of that. But what I love that you brought up is, you were just speaking about just the ability to evolve. And here you are in this space, to create something in a timely manner. You have a husband that's an architect that can help with design. So, from that side of things, how involved were you with the design, right? Because he's an architect on the residential side and you have a medical side you're designing.
Right.
So, are there differences in, what has to be specified and laid out, that was unique to him, and how did, you both kind of collaborate on that?
Well, I got lucky because he had actually worked previously in San Antonio for a firm that did more commercial, and he had actually worked on a hospital. That was one of his big projects, was working on a children's hospital. So he had a little bit of background. Plus, working with me in the past, my last practice, we actually had redone that space as well. And he didn't redo it, but he was able to give input that whole time. And so he and I worked together. I really wanted the space to be very different than the normal family practice office, not quite as cold and sterile as it can be. And so he kind of ran with that and came up with everything on his own. I honestly didn't have much to do with it. He knows me well enough to know
what you want and what your vision was.
Right.
So talk for anyone listening that doesn't understand what a TI is. So we talk about the word TI, which is a tenant improvement. And in commercial development, what typically happens is you have a space. You have an owner that owns the building. They are looking for a certain tenant. It could be retail. It could be medical. Some of them are zoned differently depending on the jurisdiction and municipality and what they're dictating. And then what happens is there's a couple ways to do this. You could have an empty shell, which some buildings you're probably looking at, and they may have a certain amount of budget that these are dollars that the developer will give you to build out the space, and then it'll factor into your lease and your monthly rent and all that stuff. Or you might have something like you had where it's a remodel. So how was that negotiated? I mean, how did you negotiate the lease, the tenant side, and figure out the dollars for the remodel? Because that's very complicated in itself.
Oh, that's so hard. And that's part of owning a business that I had never dealt with. In medical school, they don't give you business training, which they should, because many people do their own practice, and you should have some background in that. So I have no business background. I've had to Google how to do a lot of things. So it's been pretty interesting on that end. But luckily, Nick actually had his real estate license as well, and so he had some background in how to negotiate a lease, and we had a good real estate agent that helped with all of that. And so we, unfortunately, because of the location, location is everything, the TI that they gave us was a lot less because they knew that they could rent it. And the way the market is right now, especially here in Arizona, it's great. I mean, there was 3 or 4 spaces even available in that size. So we kind of had to take what we had, unfortunately. So we didn't get a lot of TI. We negotiated as much as we could and kind of showed what needed to be done. But most of it, ends up on us to do it, or you just don't do it.
Yeah, and I think that for anyone listening, so the way that works is, as you mentioned, if they're in a desirable location, it's a little bit hard to negotiate that. And then the landlord or owner of the commercial building will give you so much, and then that money will go towards construction costs, and whatever exceeds that amount is up to you. You're putting money out of your pocket for that space.
And it's hard to do that because it's not your house.
It's not your house. You don't own it.
Right. You don't get that money back, but you also want to create that space. So we, like I said, we really prioritized what was most important, what we had to have, and then just kind of went down the list and figured out what we could do out of our budget. And that's why Nick ended up doing most of the manual labor himself, because that's where we could save some money if he did it, and we had some help, from family. And like I said, even my kids were in there.
That's awesome.
Tearing stuff up and helping do things. So they're learning, which is great too. That's part of owning a business. You can bring your children. I know you do that sometimes, and they can start learning parts of that as well.
That's the fun part. It's fun. We're doing a project now. My wife was helping the client with like the furniture and stuff. So our oldest daughter, went and they worked together, and they're setting up all the furniture and laying out the rugs and doing the picture frames. And she loved it. She wants to go into, hairstyling. That's what she wants to do. Mm-hmm. But I think it like pricked a little, something inside of her where she's like, I like design. This is kind of fun, setting this up and doing someone's dream home. And it's funny how your kids, I don't know if any of my kids, we have mostly daughters, we'll see if they get into design construction, right. But they're interested. They like touring the homes we do.
Well, and think of all they're learning business-wise too, how to work hard and to put effort into something other than what their normal daily activity is.
Yeah, and let's talk about that, because when we talk about pivot, I know a little bit about your story because you and your husband shared that, as far as you were coming out here, you were relocating the family, a big move from Texas to Arizona. You were going to work with another practice, and now some things took a different direction, and here you are. And so how did that conversation go with you and your husband? You're like looking at each other like, okay, now do we go all in? And as we've been speaking about, there's so much to starting a business in a new location.
Yeah, absolutely. It was tough. We weren't sure what to do, but we felt pretty strongly. We've always talked about doing our own practice, especially given his background, being able to help with that. Our hope was at some point to be able to design it and completely build it out like you were talking about earlier. However, we kind of got thrown into this last minute and we're on a time crunch to get anything done. And we just felt like it was something that we could do. And, sometimes you just have to go for it and take a leap of faith that it will work out, even if it's not exactly how you planned and when and how you plan to do it.
Well, it's funny because entrepreneurs, you're either born an entrepreneur or you're kind of thrust into it, right?
Right.
And I look at that, it's the same way we started AFT is, I had a different plan at my stage of career of where we were back, 8 years ago.
Yeah.
And there were some events that were somewhat similar to what you had, where there was another venture we were starting up, and I was working with a venture capitalist and, as in the tech and clothing line,
Sure.
And things stopped. Like they didn't go. And there was a long story behind it. And so you pivot and you say, okay, well, maybe I should get my license and start AFT. And just like you, it's like, well, I've never owned a business. And, although I worked in construction most of my life and I had a good understanding of, the construction side, how to bid a job
Sure.
and how to run it. I don't know the business side, as you mentioned, negotiating a lease for my office and figuring out
completely
rent
different.
and overhead and hiring and all these things go into it.
So different. I did get lucky in Texas when I first moved out there. I was the first physician that the hospital had hired as an outpatient physician. And so they didn't know how to do much. And the first day I showed up, they kind of said, well, what do you need in the rooms? And I kind of looked at them, what do you mean? What do I need in the rooms? And so...
Yeah, like you need med gas, right?
Right. So many different things. And usually when you walk into a hospital-based practice, it's all set up for you and you just, go with it. The other thing that happened when I was there is that they had me start a medical spa. And so again, I had to do all the research and learning. So I actually had a unique opportunity there to really learn and build on someone else's dime. Not all of the things that I'm dealing with now, but a lot of them. And so I had some experience, thank goodness, to help me out.
Which is awesome. I mean, it's so important. There's a lot of people that I consult with and they're like, Brad, I want to start my own company. And I always ask them, well, what experience, it's not even, we use the term learn on someone else's dime, which is true, but at the same time, you're providing value as an employee. Typically, maybe
Sure.
You're not compensated at the level that you may deserve because of your talent and expertise and your work ethic. But at the same time, you're gaining valuable experience that's going to catapult you some point in the future, as long as you have that end goal.
Absolutely.
So from your side, your practice now, talk about that, because you are not just, family practitioner. You have the med spa. And so how do those two businesses relate to each other? Is it tough having different scopes of work, and emphasis in the company?
So it is a little bit, just because they work very differently. One goes through insurance, and there's HIPAA and laws and a lot of things that you have to deal with. And then the other is more cosmetic, and so that's definitely different. However, I think they go really hand in hand more than people realize. I can be treating an acne patient in my clinic and then refer them to the medical spa side, and where they can further their treatment and have more options. That's just one example. I like to be able to treat the whole patient, so I can treat them physically, mentally, kind of build that whole, the whole person, and really help treat the entire person, which I think is a little unique. There are some other family physicians that do that, but this gives me kind of that opportunity to do something a little bit more and a little bit different. And you create different relationships on both sides as well.
That's interesting. So do you have a certain demographic you're seeking? Are you looking for one arm of the business more than the other?
Not really. Honestly, a lot of people have asked me why I don't just focus on one or the other. I really love family medicine. You form a relationship with patients that is totally different than any other, even any other field of medicine, because you can see patients from the time they're born until the time they die, essentially, and everything in between. And I can do child checks. I can see a grandma for her high blood pressure. I can see the mom for her pap smear. I get to know the whole family in a totally different way than anybody else does, and people share things with me that they don't share with anyone else. So I really love that part of it. And and doing the medical spa side is completely different. You're adding a whole other element and level to it. But I couldn't really give up one or the other, because they both have benefits. The medical spa side is a little bit more fun and exciting, but the family medicine side, you really are providing a service that is completely different than anything else.
Well, I think there's value in diversification too, because markets can change, economies can change, sure. Clientele, and so it gives you an opportunity where they both can be busy, or maybe one's a little bit busier, and so you can kind of pivot between the two.
Right. And you can serve patients in both ways. Like, I'll see a patient for pap smear and then do their Botox 2 minutes later. So it can kind of be a one-stop shop for a lot of people. Or for a busy mom, it's hard to take all your kids to a child check somewhere and then go somewhere else for Botox and somewhere else for your pap smear. And I can do all of that in one spot. Which is
incredible.
Yeah.
And it's funny, I think our business is very similar that way, in the sense that, we do commercial, we do residential, mm-hmm. and we have, our clientele is very different. The commercial side, as we were alluding to, clients have either a TI budget provided by the owner, and then they may be putting a little bit of skin in the game. But at the same time, a lot of it's driven by time, how quick we can get done, because they got to be open and run their business, and this is all cost. Whereas if I'm doing a custom home, it's a little more personal, right? So the level of detail is still important, but there's a different aspect of, the mentality of each client, and it's balancing that.
And it pulls from that community we were talking about earlier, where you're kind of creating this community, and it is different on both sides, but you are creating kind of a community and giving to the community in different ways. In different ways.
Yeah, which is huge, because the more value provides your community and area, and as you mentioned, getting involved. And I love that you said this early in the episode, because a lot of people say, when I'm starting my company, how do I build brand recognition? How do I get out there? Mm-hmm. And I mean, social media, we could talk about that all day, but getting out there and speaking to people at your kids' soccer games and, school events and getting involved. And I mean, these are all things that cost a lot of time, but at the same time, if you're engaging and being out there, like, you're going to build that rapport network, and it's all about who right? It's all about that network.
It is. And it's helped with so many things, even just going out and meeting the other providers in the community. That allows me to give better patient base as well, because, if I need to get a patient in quickly, I have someone to call and contact that I can get them in quickly, or, hey, can you quickly review this x-ray, or what do you think about, so it's really easy to go to that community and give better patient care, because I have that. Same with you. I mean, I'm sure the more connections you have, the easier it is for you to give kind of exceptional houses.
Well, it helps. And I think a lot of it too is it allows you, it's funny. I always give this example. I had a neighbor that I've known for a long time, And I told them I was in construction. I don't think they really knew what that meant or what I did. And speaking with them and then through social media and them seeing what I did is like 5 years later, they're like, oh, I get it. I know what you do now. Yeah. Next time I build my house, we're going to hire you. Or, I have so-and-so that's going to be building, and that's how you build up, because it's that repetition, being in front of them. And
absolutely,
that's the hardest thing, because most people forget.
Right. They don't realize that. Well, and that's where, like you said, social media comes into play. I know when I started social media, this will date me, but it was mainly Facebook, right? And we were doing videos of injections or some sort of treatment and letting people ask questions, kind of taking the stigma away from a lot of it so they could see it and know what they were getting beforehand and know you beforehand a little bit, know your results, know what type of person you were before they even came to see you. And so it's just one more step there.
Well, I love you brought that part up, because I think there's a few industries, and I don't want to cut any out, but I know, in construction, it's very personal, like customer service communication is so key. People are investing a lot of money. Typically, one of their biggest purchases is in their home or remodel. In the food industry, people are very, I should say, very specific on what they want to eat. And if they're, if a waiter's not listening to the things that they want on the menu, they get very frustrated.
Yeah.
And the medical side is very similar. It's very, very customer savvy. People with their bodies or their health, so how does customer service or communication with your clientele play a role? Because it is one of those industries, just like construction, where I don't want to say clients are sensitive, but there's an emotion behind it.
Absolutely. Well, we always talk about bedside manner in medicine, right? Creating good bedside manner so people feel that. But in any industry, like you said, it's that customer service, how you make someone feel and the value you provide. That's what's so important. People are going to come to you because they know you and what type of person you are, and that's who they want to work with. And it's kind of the same thing. If I can provide excellent customer service and good bedside manner, people want to come back to see me or share things with me that they maybe weren't comfortable sharing with someone else. And so I can provide that extra level of care. And that's kind of something we've been trying to create too. Being new in the area is create kind of a brand that's different and unique from anyone else, that maybe it stands out. Maybe we offer drinks, or we actually did a training yesterday, and the trainer was saying, well, why don't you offer a meal if they're here the whole day for something? Why that $10 that you invest, you're just giving a little bit more, a little bit bigger, different, better, providing that extra level of care.
Yeah, which goes a long way. I think those little perks, if you will, you give it to the client, little incentives, it goes a long way. And it's interesting, because from your side, you're dealing with so many clients, so many personalities that all have different needs or services. So how do you manage the difficult ones, maybe the unrealistic ones?
Oh, you get a lot of those in medicine, but I think it's kind of the tried and true thing that the customer's always right. Unfortunately, that's kind of the reality, and you have to work with them and really help them feel like they are important and that you're willing to work with them, even if sometimes it is a little bit difficult to deal with them. You have to do that. And we have such a wide range of patients and, demographics in so many different ways. And so we really have to accommodate all the different people that we might see. Sometimes it's hard.
It is hard. The customer service side is hard. And it doesn't matter how, I look at it this way. I mean, even for us, I feel we're a lot better today, than we were a year ago and 5 years ago. But even then, as much training and emphasis we put with our team and our staff, there's still more to do. And it's hard to always deliver on expectations, because that's really what it comes down to. Sometimes in our industry, the designer has a mindset of what something should look like, or the architect.
Right.
The client has their vision, what it'll look like, and then we have ours.
Sure.
So now you're trying to marry the three, and sometimes it doesn't line up. And that's where it's that balancing act of understanding their concern and how we work through that.
Yeah, and that can be difficult with any patient or in any situation. But I think if you can have really good communication and kind of find out what they're really looking for, then hopefully we can meet their needs. And then kind of going above and beyond, like I was saying, we had a staff meeting yesterday and talking a little bit about how can we reach out additionally to our patients? How can we follow up to make sure their needs were met? Can we do anything additional? You talked a little bit earlier about building your client base, and I think a lot of that comes from reviews. So previously it was just word of mouth, right? And now there's Google, there's Yelp, there's all these other aspects that people can go to. And so if you're not providing good service, they're not going to give you good reviews, and people are coming to that and trying to find out that information. I got lucky. I was able to move over some of my reviews from Texas, and that's been phenomenally helpful because people are able to look at that and see that rather than starting from scratch. But you have to keep building that. That's something you keep building. And so if you're not really listening to the patient and getting what they need and what they want, then you're not going to continue to provide that excellent customer service.
Yeah, and it's interesting because when you look at the analytics of any company, the more reviews you have, especially Google Maps, that's really important, because Google is driving so much SEO,
right.
Content. And going back, you mentioned training with your team. So how often do you train? Because, and we'll get back into the hiring thing, because that's always, that's a curiosity to me starting a new company and, especially in the medical field. But going back to the training, how often do you have team trainings?
Well, right now we're doing it a lot because we've brought on a lot of new devices. And so we're making sure that they're all appropriately trained in that. But in the medical field, I'm always doing continuing medical education. And so they have requirements too, depending on what part of the practice they're in. But I just think the more training you can do, you've got to do training in customer service, you've got to do training in the devices, you've got to do training in the procedures. So the more you can do, they feel educated as well. It helps the staff to feel like they know what they're doing and they feel better. And they all have things to bring to the table too. So they have things that they can offer and recommend and make the team better too.
I love that because there is a lot that, the more we speak with our team and staff and employees, that's that feedback that helps us as business owners, to create a better environment for them. And your industry is so much more difficult because the continuing education, you have a lot of third parties that come in and medical devices or different products or technology and applications. And so you're trying to say, is this a fit for me? What's the research on this? Is this going to work for my client? And then how do we factor it into our business?
Yeah, and that's something that I've always, you always want to be kind of at the top of the line and know what's the best treatment for the patient. I've done extra trainings because I think you can always learn something from someone else, even if it's a new technique, especially in the cosmetic side. When I'm doing injections, there's all these new techniques, there's new products all the time. So I do my best to kind of stay up on that, but it's difficult because there's so much out there. But that's where social media comes in play too, is there's so much more information there. It's become kind of a search engine for patients, but it also is for me too to see what other people are offering and how they're offering it and how can I better help, my patient by offering some of these services.
So how collaborative is the medical field as far as, if you're looking to collaborate with other medical practitioners or executives or business owners such as yourself, not here because and you're in a competitive market, but is it collaborative if you're working with doctors in other parts of the country?
It actually is a lot more than you would think. And it is more even in locally too, because it helps me to know all the providers in the area and it helps them as well because we kind of refer back and forth to each other. And so we do that a lot. I recently started the segment that you mentioned to Ask a Specialist. And so I'm working with different specialists all over the country to provide more education to my patients. And I think that's what a lot of the providers want to do is provide more education to their patients because they're going to Google, right, to ask a lot of the medical questions. But if we can give them good information, we can maybe save them an office visit or direct them to the right provider.
I love that. So what Leila does is for any of you to go on her Instagram account and follow her, she'll go live. So she'll reach out to other doctors and nurses and medical professionals and their specialists. I know you had Raul Meehan, who I know who's, you had the dermatologist in Utah, that I was mentioning. And so these are people that are providing valuable information. And that's the key to being a successful business. When you look behind the scenes, yes, you probably on an individual level, Leila, aren't profiting on a 1 hour IGTV.
Oh, no, absolutely not. And that's taking time. But I want to provide value to my patients and give them education. And that's really what I've done with social media is I want to give them more education. And if I can allow them to determine, do I need to see the specialist or can I get some of my questions answered before? Or is this something that a family practice physician can take care of? But I think just providing that extra layer of education. I also do Medical Mondays. So I'll try and do some sort of medical tip or talk about some disease or something that's helpful. I also did that segment. I did a segment in Texas on a show where I was doing kind of healthy educational health tips. So if it was Diabetes Awareness Day, talking a little bit more about diabetes and how to screen for that, or if you have high cholesterol, what are some things you can change in your diet? So kind of trying to provide more value than just, and it's hard because I only get a couple minutes with the patient in the room, and this just gives me another level of being able to provide more information.
Well, it's interesting because I think back of kind of our methodology and thinking behind social media, how we use it. And, we have different avenues. Our YouTube channel, we're trying to provide little informative videos about the industry that I know a lot of our clients and people watch to give them, we talk about cost plus or lump sum or some of these things that they've heard the terms, what's the upside of either, and how it relates to our industry. But one thing I have not done a lot of is the IG Live with other professionals that are bringing value, and it's, you have to navigate your time too, but there's a lot of value to it.
Yeah, people really like to be able to ask questions too and be involved and feel like they kind of know you on that level. But I think all the education that you're doing in any business, any education you can give your clients is going to provide more. They're going to want to come to you because you're going to give them that extra education on what to choose or what product to choose or what have you.
So do you ever have any reservation as far as when you're out there so publicly on these forums that you're going to have, we use the term troll, but you have people that'll come out and, you have the negativity, or you may have competitors that may look at that and say, I'm going to do that. Do you have any of those concerns?
Oh, I have hesitation for sure, especially when you're doing an injection or something online, because people are going to critique your injection technique or, how you're doing it or what product you're using. So I definitely have that reservation. And I've seen some people kind of pull back a little bit. And we have to be careful just because of HIPAA as well. So there's that concern, always making sure that we're staying compliant with the laws for patient, safety.
Yeah, because that's the other complication from what you're dealing with. You have the HIPAA laws, the privacy for health. Mm-hmm. And then as far as the back end side, I think one thing that's unique about what you're doing is the medical field has become very complicated. At least I'm not in it, but my understanding of billing and insurance, and some people have the company and some people have their own healthcare. And so you're trying to navigate the billing side, but then you mesh that with the med spa. Well, a lot of these are cosmetic or cash or credit card. Yes. So how do you balance, all the billing?
That's tricky. Insurance is it's crazy. I don't know how we got to where we are. It's very difficult to deal with insurance and to understand which insurances we take. Even just getting credentialed, especially with COVID, kind of slowed everything down for me. And then making sure that we're doing everything appropriate for that. I actually have a great biller that she's helping me with all of that, luckily, so I don't deal a lot with that part of it. And then with the medical squad, just coming up with pricing and making sure that we're competitive, and that is mostly cash pay. So you kind of have to balance the two and make sure that you've got both of them lined up, but they're both very different.
Because that's always the hardest thing, is trying to figure out for you, it's inventory. Especially on the med spa side, how much product do we need to have?
Right.
How much are we going to sell? What's the price to make sure that? So how are you, we use the term job costing in construction, where we're really tracking projects and how much are we spending? What are our overages? How much is it costing us? How much labor does it take to do something? I mean, to what level of detail do you get involved on the medical side?
Well, I'm doing a lot of it right now just because we're really small and we're just starting. So I've had to kind of play into that and research that a lot more than I've ever had to do that before. And it's just kind of a learning curve. Like I said, I've used Google a lot.
Well, as we're speaking, then there's Google and YouTube and, all these other professionals that we can rely on, right? That can help us out.
Yeah, thank goodness.
It's funny, from a construction side, I haven't been involved. I was fortunate. There was a builder in Ohio that reached out to me, and he said, Brad, we're part of a Builder 20 group. His name is Gino, a good friend of mine. And he invited me to be part of their Builder 20, which, for us, it's a network of 20 builders throughout the country, and we all are in different states. We don't compete. And we share financials and contracts and documentation. Great. And how much do we pay for a project manager? How much do we pay for a superintendent? How much do we pay our cell phone bill?
Nice.
Yeah, so we sign NDAs, right? And we share all this stuff. And so quickly, it's like, Leila, what contracts are you using? How do you do a cost plus?
How are you doing this? Oh, I love that.
Yeah.
That's great.
And it was huge because I feel like in 6 months, just this light came on of education. I'm like, where has this been my whole career? Because, there's so much information of people that have made the mistakes and worked through legal issues and construction methods. And now I have a resource of 20 experts that I can reach out anytime that are there to help.
That's great. Yeah, no, and I have talked to other people that have been in practice. Luckily, a couple of people have reached out when they saw I was doing it and have helped a little bit. And there are some things that are just set. I mean, there's only so much you can do. And I'm lucky. I actually have I have great staff that have all helped me in different ways. So my estheticians have helped me kind of figure out pricing in the medical spa side. And then I have a great biller and medical assistant have worked in the field before. So they've been able to give me a lot of information as well. So I think having great staff is super helpful as well.
It's super helpful. That purchasing and coordination side is so key. It's so hard.
Yeah, it's so hard, and just kind of keeping up on it and making sure we're going to start making money and we're headed in the right direction. It's hard.
Sometimes it takes time with a new company too.
It is. Yeah, to get there for sure.
So how is the hiring process? When you're hiring somebody and you've done it quickly, whether you have 2 employees or 20 employees, what is it stuff that, what are you looking in them? Is it a personality? Is it an experience? Is it a little bit of both?
Absolutely. I really want to create a brand, and I want it to be excellent customer service like we were talking about earlier. And so finding people that are going to fit that mold has been really important to me. I got lucky that I'd actually met all the people that currently work for me previously before we moved here.
And so how did you meet them?
So I had come probably 6 months ago to do an injection event, and they all assisted in that event. So I had met them before. So
hold on, let me understand. So where do you come up with, an injection event? I mean, how did you start this? How did you market? And then how did you find them to even come participate with you?
So they were all through a mutual friend, and they had all come. I needed some estheticians to come do microdermabrasion and chemical pills. And so I found them that way. And then the biller had worked with this lady as well, and she just assisted on the side. And then marketing was mainly through social media. That's kind of the way to do it. And I've done injection events, in Utah. I now go back to Texas to do them through social media, able to kind of continue to do that. But that's how I met them and knew them a little bit. But I think it's also what we're talking about with the community base, having that community base where you can pull and say, hey, do you have someone that that works in this field? Because you really want to have some background. It's hard to just take someone's resume, meet them for 5 minutes, and think that they're going to be a good match. I think pulling from that community and having a little bit of background on that person. Because like I said, I really want to create a brand where people get exceptional service, and that comes down to your employees. There's only so much I can do. So much of it comes to them. And I want people that want to build up and help grow the practice too, since we're so new. So I've gotten really lucky and have exceptional employees right now that are willing to kind of build with me and deal with all the growing pains of a new practice.
It always are growing pains of a new practice. And I love that you're looking at as far as the culture aspect, the personality, because it's so important when you think about you're not always, you're not able yourself, Leila, to be in front of every customer. Like, you just can't. No. And so you have to have people that are a good representation of you and your brand as they're conversing bedside manner with the clients.
Yeah, well, and I've had my mom stop going to a doctor because of the front desk staff. She loved the doctor but couldn't stand the front desk. And
so common.
Every touch is so important. And so for me, that's really important that they kind of understand that brand that I'm trying to create. Plus, I want to create a working environment that they want to come to work and enjoy it, especially in my field. It's mainly females that we're working with and a lot of working moms. And so I want to have flexibility and create kind of a good work style as well, which is hard. It's been hard for me to kind of figure that out.
So that's very interesting because, the more I speak with people, it's the same thing, especially in the medical field. Maybe they have a dentist they really like, but they don't like the billing staff, right? Or how they do their billing, and they just don't go.
Yeah, happens all the time. And so it's really important that every touch that patient has with whoever in your clinic, that it's
very positive.
Mm-hmm.
So how much I don't do Botox. I mean, maybe that's a confession here, but I know that's very common. So how much do most people spend on Botox?
Well, so there's a wide range. It really depends what we're treating. I would say a couple $100 is usually where you're starting at.
And is that like a monthly that they're coming in?
So Botox is every 3 months. Filler tends to be closer to a year, kind of depending on where we're treating and what we're doing. It can range. We've actually created a really cool membership model. So especially for women that don't want their spouses to understand how much they're spending on this. And so how it works is they pay an amount every month, and they kind of choose their amount, so depending on what services they're interested in. And so they pay that amount every month, and is kind of like a savings account.
Yeah, like a billing. Yeah.
Right. So in 3 months, if they've been doing $200 a month, when they come in 3 months, they've got $600 to spend on any treatment or Botox or filler, whatever they want to do. And in addition, they get a free service every month. So we're getting them in the door, allowing us to have more interaction with the patient, kind of form that patient communication and community. And they get some extra stuff. They get discounted products and services. So it's been kind of fun.
So it probably works good too, because they don't have one huge cost at once either. They can, monetize this over 12 months and then gives you clientele.
It's not so painful. Yeah, it's not so painful to pay for it once, especially if you get Botox and filler. I mean, you could be $1,000 in pretty easily. And so it kind of takes that load off. So it's not quite as painful. Plus, there's so many other services we offer. I mean, laser, again, is one that kind of builds up, and you have to spend a lot of money at one time, so it spreads it out a little bit.
So as far as from a pain standpoint, is it painful? How long does it take typically to do
Botox? If you did Botox once, you wouldn't believe how easy and painless it is. We use a teeny tiny needle, maybe takes 5 minutes. Pretty minimal.
So pretty easy.
Yes.
So going back to the medical side, because you're speaking about just providing value on someone if they have high cholesterol, so how involved do you get from the dietitian standpoint, from a diet of your clientele and customers?
So I try and help as much as I can, and that's where social media helps me as well. Or I have a blog too, where I've actually posted recipes, and I try and do a monthly newsletter as well, where patients have more access to all of that. Because I only have so much time in the room to help the patient and go over all of that. But I do try to help with that, because I see a lot of obesity, a lot of diabetes, a lot of high blood pressure. I see all of that. And so trying to kind of help with dietary things. I have some handouts that I have prepared to help patients as well.
And it's tough. And I don't want to take this too off topic, but one of the tough things about America, and I've lived abroad, and I've seen diets of other countries, and it's very different than American. We are eating a lot of processed food, a lot of corn syrup, a lot of starch. And
we eat out a lot.
We eat out a lot. And so there's a lot of processed things that are hard for our bodies to digest and work off. And it's a time thing. It's a stress thing. I mean, there's just so many elements to it.
There's so many elements. The issue is, though, obesity is kind of the leading cause for so many things: depression, anxiety, all those other diseases I just mentioned. And so it is a big problem that we're facing as a society, and we've got to kind of get it handled. The other thing I've been thinking about with COVID, I think with so many people having restrictions, not as many people are going outside, they're not exercising, they're not eating as healthy, and that's something that we can do simply to kind of keep ourselves healthier too.
Well, I think the mental part of that is really difficult, because I've seen COVID, people around the country and people I network with, and, some of them have done really well. Like COVID, okay, I have more time, I'm not commuting, I can work out, I can go run, I can do more at home. Like, I'm active, I'm doing projects around the house.
Sure.
So they're staying more active, whereas some of them, it's tougher because some markets and demographics are different. They're more restrictive, maybe parts of California. And so that's taken an emotional toll where now they're not exercising, not going to the gym, and they're eating more. And, they've had the reverse effect.
Yeah, I've seen more anxiety and depression in the past 6 months than I think I've seen before, just because it is affecting people in different ways. And so, like I said, really focusing on those healthy lifestyle things that you can do, especially if you have more time and more ability to do that. I think that's very important, and really will play a difference in how people get out on the other side of this whole pandemic.
I know, and who knows when it's going to hit right now. We're in December, we're going to see here.
I know.
So from a family practitioner side, how often do you recommend that a family, spouse and children, how often should they be coming in?
So it really depends on the person and their risk factors and their family history, but just as a general rule, once a year is kind of a good amount of time to be seen. That way that the physician can assess how often you need to be seen or what other issues you might have that might require more attention.
And then I guess from a health side, there's certain things, in our network, a lot of males, as they're aging, they talk about prostate cancer, these should get checked. I mean, are there certain major things, male or female, that people should be checking, as they age, that could be better if they find it early?
Absolutely. There's so many things, and I really like to focus on preventative medicine. My goal is to keep my patients healthy so we don't have to deal with a lot of that later on. So in your 20s and 30s, that's when you really need to start seeing the doctor, especially for females. They tend to only see the OB, so they haven't really seen a family physician. But you need blood work, regular screening blood work. You need pap smears as females. You need certain vaccines. And then when you're in your 40s and 50s, depending on your family history, you also need possibly colonoscopies and mammograms, prostate cancer screening. So being aware of that. And then when you get into your 60s, that's when you really start seeing, you need more immunizations. You might need a DEXA bone scan to screen for bone density. There's so many things that kind of build up as you get older. But that's why I recommend at least once a year, starting kind of in your 20s, to make sure you don't have any other family history or other comorbid issues.
And I think that's really important for anyone listening, and especially for you going back to the network side, as you're looking to bring value as a business owner to your clientele, no matter your industry, this is, Leila, where you succeed, because if someone comes in and they need some of these specializations, or you're doing the regular checkups with them, then now you have a network of professionals that you can refer, to outsource that to.
Yes, and that's where it's super helpful to have those, so I know who I'm referring to, because people get frustrated with that too if you refer them to a bad place. Or
because then they may not come back to you.
Right. It reflects on you somewhat too. So that's been important for me to really meet those professionals and kind of know who I'm referring to and know how quickly they can get in and, get whatever test performed that they need to.
So how does COVID limit that? Because you mentioned get in to be seen. I mean, are there limitations with how many people you can have now at the facility? And we all have to have social distancing and all those other things.
Yeah, COVID has made everything a little bit more difficult, and we've always worried about patient safety and keeping everything clean, but it's created a whole new level of that. We actually keep patients in the car and check their temperature before they come in. We're doing a screening, kind of a COVID questionnaire screening before they enter into the office. And then I think it's made people more hesitant to come in, so we've actually offered virtual visits as well. So they can do it all online. They actually see me. It's all HIPAA compliant, and I can go through a lot of their medical treatment that way.
So I was going to ask, how prevalent is it now to do the online telehealth, remote Zoom, whatever?
It's very common right now. I don't know if the insurance will keep allowing it, because it wasn't previous. This is all
So they're
new.
allowing it now, and it is billable through insurance.
It is.
Right
It's
now.
different. It's not the same as an office visit, and it's a little bit harder for me, especially with a new patient that I've never met, because I haven't done a physical exam on them. I don't have
height,
a good
weight,
rapport.
Health, blood pressure.
Right. And so, but I've actually found a lot of people have a blood pressure cuff at home, or they can check their weight for me.
Go to Walgreens maybe and check.
Give me some information. So we've been able to do quite a few of those, especially for the people that are hesitant or have comorbid issues that aren't allowing them to be out in the public as much.
Wow. Yeah, there's so much to that. The balance of what you're dealing with, COVID for us is restrictive to an extent. Being construction, we're an essential service. Right. And so we're still out there. It's a little bit easier, I'll say, for me. We're on job sites where bigger projects, we can keep, a tile guy on one side of the house, cabinet guy on the other. Yeah, we can separate them, make sure they're not hanging out all the time and eating lunch next to each other. But so that part's fairly easy. But for you, where you have so many bodies coming in and out, and it is a medical facility, so some people, their immune system may be compromised, and that's where you're trying to really balance and take care of everyone.
Yeah, so we actually have 2 waiting rooms, one for medical spa and one for family practice, which has been nice, because that allows us to kind of keep that separation. We try and get people back as quickly as possible. We're trying not to overlap patients too much so that there's not as much interaction between patients as there was previously. So we've tried to do every measure we can to kind of help that, but it is really difficult and has completely changed, I think, just the way we look at everything now.
So how many square feet is your space? Because to have 2 lobby rooms and configure that.
It's pretty small. I'm trying to even think.
But the lobbies, but you have 2 separate entrances for each side.
We have 2 separate lobbies. We don't have separate entrances, but we have 2 separate lobbies. It was kind of an unusual layout. I'm not really sure what they used
what the previous tenant was.
Yeah, we think 2 tenants before, we think it was a hairdresser. And so I think that's what the back lobby area that we now use it for. But it was kind of an unusual layout. I'm not sure what the
And now, because you've been open how long?
We've been open since June. We kind of did a soft opening in June, and we were able finally to do a grand opening in October. So there was a lot of delay because of COVID and just kind of building everything slowly. Took a little bit longer.
And now 2021, very promising, very excited about next year.
I hope so. I hope it continues to go in the right direction. But yeah, we've had a lot of growth. We had an overwhelming response at our grand opening. We had so many people there. I think we were able to provide some value. Again, trying to do education. We had all the drug reps come in, kind of talk about their different products and services, perform some free procedures. I think people need to see it. Just like you were asking about Botox. If you see Botox one time, you say, oh, that's it.
That's not a huge deal.
Yeah, I did 2 new patients yesterday that had never done it. And afterward they said, well, is that it? And so I think just being able to see things and ask questions is really helpful. I really like being able to do those events.
So those grand opening events are, when you talked about, having the injection event, so is that where you're actually doing it? So people are watching and they're getting more comfortable with it?
People get to watch it and see it, and we'll do live demonstrations of microneedling or, something so that they can kind of see what everything looks like and realize it's not that painful, or ask the person that's getting injected, how much did that hurt?
Yeah.
It's kind of nice to be able to have that option.
Which is always a concern for most of us with the medical side.
Yeah, well, but I think it's like that in any business, really. If you can show people what the process is going to be, I know you do a lot of that, showing them the process of building, then people realize what they're kind of getting into.
Yeah, they do. And sometimes to that effect, the more you show them and transparent, not everything is as easy as they think. I found that over the years, our clients have become a lot more educated in construction, because in the beginning, they'd say, how hard is this, Brad? You're getting a few framing bids, you send your framer out there. Well,
sure.
Okay, it's not that easy, because now we show them all the training behind the scenes. Like if I'm going out to my framer, are we checking the nailing patterns, right? Do we have the right support? Are they following the plans, the shear, all these different things, the truss hangers, and there's so many elements that are extremely technical that actually affect the structural integrity of the home.
Oh, absolutely.
And it's not so much just, okay, this framer's $100,000, this one's $120,000. We're going to bring them in, go do it, talk to me in 6 weeks when you're done. It's not that easy.
Oh, absolutely. It's funny that you say that. I was thinking of my husband one time. He was designing a house and the people wanted to move the staircase.
Yeah.
And they just thought it was an easy fix to move the staircase. And he kind of had to explain to them what that entailed and how much more time and effort would go into moving that. All the things, like you were saying, I don't even understand half of it, but the electrical is going to move, the walls are going to move,
and depending where the base of the staircase is, the footings,
Absolutely.
And there's so many structural components, because I'm sure he's designed, the way, the first and second floor, how it's tied together, and the interior shear and all that stuff.
So there's so much that goes into that, and that's where I think, again, just educating your clients on whatever you're doing so they have a little bit of background and understand what's entailed is really helpful, and people just feel much more comfortable and come to you because you're providing that extra value.
Well, and it shows you as the thought leader. You're the expert, Leila, right? You're out there, you're presenting the stuff, and so there's a comfort for your clientele where they come in. Leila knows what she's doing. I'm comfortable bringing my family here, myself for the med spa.
Yeah.
So what is, before we close, going back to social media, have you seen more success on one of the platforms as opposed to another? Where do you focus most of your time as far as social media? Because there's so many different platforms out there.
Well, I think it's changed a lot. Because like I said, I kind of started on Facebook, and that's where I got most of my business. All my new clients, especially med spa wise, were coming from there. But I think it's transitioned a lot. I wish I was an expert. It's completely changed since I started. I know Pinterest was really big for a little bit. It still is. I actually think we underutilize Pinterest. But I think Instagram is where a lot of it is at right now. But I also think it's the hardest because the algorithm is always changing. Sometimes I think I have it figured out and then it's completely changed. So I'm definitely not an expert. You're a lot better at it than I am. But I feel like that's where I'm getting a lot of the information and the interaction with patients more.
Yeah, it's interesting because we use all of them. Well, to the best we can.
Sure.
But it's funny going back to the Pinterest. My wife and I were on vacation a while back, and she found these amazing restaurants on Pinterest, and I would have never guessed. I'm thinking Yelp or something or Google, and she's on Pinterest, and these were like amazing restaurants that people recommend.
Well, and I think people are using social media as search engines now.
Yep.
So they're not just going to Google and looking at reviews. They're kind of going.
Everyone's on their phone. Yeah, the smartphone.
They're on all these different sources, and that's where I think, as much as sometimes I have a love-hate relationship with social media. But it's almost crucial for any business now, because that's what people are using as a search engine to kind of get to know what they're getting into before they get there.
And all the different platforms are competing for our attention too. So
they are, and I think it kind of depends on demographics too. That's the other thing I was going to say. Facebook tends to be an older demographic, which I am still trying to attract.
And sometimes a little more political, which is tough.
Yeah, which is hard. I stay out of that. And then the newer, younger patients tend to come more from Instagram.
Yeah. So what's exciting? What's upcoming for you?
Well, we just started that membership, so I'm really excited about that, because that really has created a whole different community, and we get to see those patients a lot more. We're also doing virtual skin consults, which I'm really excited about. We just kind of are starting to roll this out, where people can meet with either myself or one of the estheticians to find out what skincare we recommend, and then we can actually ship it to them. So that's really nice. It's allowed us to kind of open the market. Besides just being here in Arizona, we've shipped a couple different places, so that's really nice. And then I'm hoping to keep building this Ask a Specialist series. I think that's going to be kind of fun for patients to learn more and feel educated.
And maybe even turn into a podcast at some point.
Maybe. That's what we've been talking about.
If you're ready to take on that venture as well.
One more thing.
And where can our listeners find you?
So I just started a new Instagram, so that's Prescribed Health, and that's just mainly health and medical. My original Instagram is just Prescribed Design. That's my family, but I still do the Medical Monday aspects there. And then I've got a blog, which is Prescribed Design as well. And then we've got a new website, so Prescribed Health.
Easy enough. Well, We'll have all those tagged, and can't thank you enough, Leila, for your time today.
Thank you so much for having me.